My name's Brad Collett. I've been a Cenegenics patient for about 6 years now. I was getting into my 40s and just had always been pretty active and always kind of watched what I was eating and things of that nature. But at that point, just began to just kind of realize just didn't seem to have the energy, wasn't doing as well in the gym and things like that as I had been. If I needed to do other things, was moving the furniture around or doing some other things, just, felt like I'd rather take a nap or something like that. And so that was one of the big things. It was like I really should not be doing this with the activity that I've been trying to do. And also I have a little bit of a family history of a lot of chronic medical problems. It's one of the reasons I also wanted to come in. Found that weight management was becoming more of an issue despite what I was doing with the diet and the exercise and everything else. So sought out some help then at that time. Some of the fitness testing that we typically do here significantly changed. When I came back the next year, there was a pretty dramatic difference in the scores with pretty much everything that I'd had, and weight had also significantly changed over that time frame as well. I was lucky in that I wasn't dealing with a specific health issue like a pain or something of that nature before I came in, but definitely was able to notice a much higher energy levels, able to exercise much more frequently and for longer periods of time. And even when I wasn't exercising, things like sleep were better, digestion was better, all of those things were really kind of improving. A lot of it, I think, was just in general, just my activity levels were able to go up, and I was able to tolerate those things much better. So that's one of the things that for me kind of motivated me in the first place to come in. And I find that I do better when I have a pretty regimented program, something that I can kind of set some short-term and long-term goals with. Dr. Mokhtar in particular, is because he's monitoring the labs pretty frequently, we're also able to kind of see really on about every 3-month basis is what I'm doing. If I've made some changes, is that working both on the inside and on the outside? So those kinds of things have been really significant. There's a lot of feedback. I mean, if I send them an email, I'm generally getting an email back that day with some pretty specific answers, which is really great. I'm a doctor myself, and I can just tell you that a lot of traditional medicine is dealing with a specific medical problem that people have, which is great because we still use medicines, and I'm on medicines, and that's fine. I realize the importance of that. But a lot of the time what we're dealing with in medicine though is we're trying to fix a problem, a symptom or something like that. Whereas this is really more of an approach of kind of helping you not just to fix a problem that you have, but to really achieve optimal health. I think there's a really big difference between taking your car into the mechanic when it's broken down and going in and getting it tuned up so it's running well and running as long as you can keep it running as well. I love my wife, I love my family, I want to spend as many quality years with them as I can. And this is helping me do that. It really is. And I don't want to be on insulin. I don't want to be on 14 medications for my blood pressure and things like that. I want to stay as active as I can for as long as I can.